we are going to see about the fascial spaces of hand. Note the spelling fascial, okay? Fascial spaces of hand. If we speak about the fascial spaces, so there are Thenar space, Midpalmar space, dorsal spaces. Okay, so now we will see one by one. And so what is fascial spaces of hand? Normally in the hand we have so many spaces formed by the fascias of the hand. Okay, normally it is filled with the loose connective tissues, but once it gets filled with the pus, then it will be distended. Okay, until then this will be filled with the loose connective tissues. Once it is filled with the pus, then it will be enlarged and seen. Okay, so it is a surgically important area where this should be dealt with. Okay, it is a surgically important spaces that is present in our hand. So before going into the topic, just we will draw the picture first. So now it is the surgical, we know that it is a fascial space that is present in the hand. So you just take a transverse section of the hand. Okay, just I am taking the transverse section, right? So if I take the transverse section, see here. So this is my palmar skin, right? This is my palmar skin, and there will be bulging that is caused by which muscle here? Thenar muscles, right? This will be formed by the thenar muscles, and here will be the hypothenar muscles, and this is the space. So the skin continues dorsally now, right? So I am taking the cut section of my palm, okay, of my hand, so that this area is formed by the skin of the thenar muscle, hypothenar muscle. Then skin goes laterally, right, and it goes dorsally, and it goes, and the skin covers my thenar muscles, and middle it is hollowed, right? It is hollowed, and this is the skin of the palm. Okay, consider this is the skin and the superficial fascia if I take the cut section. So this is my right hand. Okay, so cut section and you are weaving. Okay, so this is the, then what will be seen below the skin and superficial fascia? Yes, that is the deep fascia. So I am drawing here the, so deep fascia in the center of the palm is modified into palmar aponeurosis. Then in the lateral it covers the thenar muscles, and this side covers the hypothenar muscles, and it goes dorsally, right? So this is about the deep fascia. Okay, now let me draw the bone. Okay, let me draw the bone. So since it is a cut section, my first metacarpal bone will be seen like this, second will be seen like this, third, fourth, and the fifth, right? So these are the 5 metacarpal bones. Okay, and if I draw the metacarpal bones, immediately I can draw the muscles. What are the muscles in the metacarpal bones? We already seen. Yes, palmar and the dorsal interossei. We know that palmar and dorsal interossei muscles arises from the metacarpal bone. So this is the palmar and the dorsal interossei. And if you see, so now this is the metacarpal bone with the palmar and dorsal interossei anteriorly. So let us mark it. Okay, so here this is the skin and the superficial fascia. And let it be the palmar aponeurosis, right? Palmar aponeurosis. Now, from the palmar aponeurosis, a septa, okay, a septa arises from the lateral side. Okay, this is the lateral border of the palmar aponeurosis and this is the medial border. From the lateral border of the palmar aponeurosis, a septum that is called as lateral palmar septum arises and it is attached to the fifth metacarpal bone. Sorry, first metacarpal. So this will be the first, second, third, fourth and fifth. So this is the lateral palmar septum. Okay, now so this will be the lateral palmar septum. Right. Now, from the medial border of the palmar aponeurosis, here one more septum can come and it fuses with the fifth metacarpal bone. So, we can name it as, yes, medial palmar septum. Right. So, medial to the medial palmar septum and lateral to the lateral palmar septum, we have here group of muscles that is called as thenar muscles here, right? And here we have the hypothenar muscles. Then we have one more septum also that is called as intermediate palmar septum that arises from the middle of the palmar aponeurosis and it goes to the third metacarpal bone. So this is called as intermediate palmar septum. So there are three palmar septum arises from the medial border, lateral border and from the intermediate area of the palmar septum, and the lateral palmar septum attaches to the first and the medial palmar septum attaches to the fifth metacarpal bone and the intermediate palmar septum attaches to the third metacarpal bone. Okay, now we know that. Now everything is clear. Now we will move on to the what are the structures will be present inside it. Up to this you are clear, I think. So now we will go to the muscles. Okay, so what are the muscles? If we speak about the muscles, okay, so muscles and the nerves and the vessels. Okay, so here we see this is the medial side. So the superficial palmar arch we have already discussed. It is formed by the direct continuation of the ulnar artery and it is completed by the superficial palmar branch of the radial artery. So this is the ulnar side. So this superficial palmar arch is nicely formed here, that is formed by the direct continuation of the ulnar artery and it is completed by the superficial palmar branch of the radial artery. With that, I can draw some nerves, digital nerves. Okay, digital nerves and the vessels supplying the here 3 and here 2. Okay. Digital vessels and nerves with the superficial palmar arch. Okay. Now, if we go below that, after the so from above to below, now we first skin is there, skin, superficial fascia, deep fascia, that is here it is called as palmar aponeurosis. If we split the palmar aponeurosis, next structure you will get will be the superficial palmar arch and the digital vessels and the nerves. Next, if we go down, we will get the tendons, long tendons. What are the long tendons here? So, here will be the superficialis tendon for the medial 3 fingers and here will be the second finger. And down we have the superficial profundus tendon for the 3 fingers and here will be the 4th finger, right? And what will be here? Here will be the tendon of flexor pollicis longus, correct? And all this will be enclosed in the, we know that it should be enclosed in the bursa, right? Radial bursa and the ulnar bursa. Let it be. Okay. Okay. Now, one muscle I have not put now. What is that? Yes, that muscle is the adductor pollicis. If we take a section like this, the transverse head, we have discussed the transverse head of adductor pollicis, no? So that will be seen. Okay, that will be from the third and the second and the third metacarpal bone, the transverse head from the third metacarpal bone will go, no? So that is this one. Okay, so this will be the adductor pollicis muscle and the fascia covering that. Okay, so this one will be the adductor pollicis muscle. Okay, now this one will be the palmar and dorsal interossei muscles, right? So all this will be the palmar and the dorsal interossei muscles. This will be the thenar muscles. This will be the hypothenar muscles. This will be the flexor digitorum superficialis, and this will be the flexor digitorum profundus. This will be the flexor pollicis longus. This will be the superficial palmar arch, and this will be the adductor pollicis. Now, what is missing in the flexor digitorum profundus? We should draw the lumbricals, correct? So, you draw the lumbricals also with that, right? One, two, three, four, right. Okay, so we have drawn the lumbricals also. Okay, so now this is about the structure. Now, where is the space is present? The midpalmar. So, here is the space and here also a space. So, what is this space? This space is called as Thenar space, right? And this space is called as Midpalmar space. Midpalmar space. Okay, so now we got the boundaries for the space where it is present. Okay, so if we want to, so this is the picture. Once again, I will revise the picture. See, this is the superficial, this is the skin and the superficial fascia skin, and it covers the thenar muscles, hypothenar muscles, and it is going. Next one will be the deep fascia. Here it is called as palmar aponeurosis, and the deep fascia covering the thenar muscles and the hypothenar muscles and goes as this one. And there is the lateral palmar septum, there is the medial palmar septum and the intermediate palmar septum. Before that, we have to draw the first, second, third, fourth and the fifth metacarpal bones, and the lateral palmar septum attaches to the fifth, and the third and fifth metacarpal bone receives the medial palmar septum, and the third metacarpal bone receives the intermediate palmar septum. Now we are dividing the space into two areas. One, so that we have superficial palmar arch in the lateral, in the medial side with the flexor digitorum superficialis tendon, profundus tendon with lumbricals, and in one more side we have for the second fingers profundus and the superficialis tendon and the flexor pollicis longus tendon, and below that we have the midpalmar space, and in the lateral side we have the thenar space. Now we will go and write what about the boundaries now. Okay, so now here is the thenar space, right, and here is the midpalmar space. How we can write the answer? See, so boundaries. So how you can first, it is the hollow space present on the thenar side. Hollow space on the thenar side. First point. Okay. Hollow space on the thenar side of the palm. Here it is the hollow space on the inner aspect of the hollow space in the inner aspect of the palm. The inner aspect of the palm. Okay, second one. What is forming the anterior boundary for this space? Thenar space. So, here is the thenar space. So, what is forming the anterior boundary? Skin, lateral half of the palmar aponeurosis, digital vessels and nerves supplying the, so first we will write skin with superficial fascia, skin and superficial fascia. Okay, next will be the lateral half of palmar aponeurosis, Next one will be the digital nerves and vessels supplying one and half the lateral two fingers. So digital nerves and vessels. Okay, next what will be that flexor digitorum superficialis and flexor digitorum profundus tendon for index finger, and flexor pollicis longus tendon for the thumb. Okay, These are the things that forms the anterior boundary for the thenar space. Now we will go for the hypothenar space, for the midpalmar space. So what is forming the anterior boundary? So this is about the first point. Okay. So what is forming the anterior boundary? Same thing, skin and the superficial fascia. Yes. Next one will be the medial half of palmar septum, so palmar aponeurosis. Right. Next, below that we will have the superficial palmar arch, with digital vessels and nerves. With digital vessels and nerves. Right. Next one, what we will have? We have flexor digitorum superficialis and flexor digitorum profundus tendon for the first, second and the third fingers, and lumbricals associated with lumbricals. Okay, so these are forming the anterior boundary of thenar space and the midpalmar space. Now we will go to the posterior boundary. Okay, now third one, we are going to the posterior boundary, right? So posterior boundary for the thenar space. So what is forming? Fascia covering the adductor pollicis and the adductor pollicis with the metacarpal bone with the intraossei muscle, right? So we can write it as fascia covering the adductor pollicis with muscle. Okay, adductor pollicis with muscle. Then we have the intraossei muscles, right? Posteriorly we have interossei muscles with the metacarpal bones. So this forms the posterior boundary for the thenar space. Then if you go here, what is forming here? There is no adductor pollicis or the fascia. Directly we can write it as the posterior boundary is formed by the metacarpal bones with interossei muscles. Okay, now anterior is over, posterior is over. Okay, next we will go for the medial and the lateral boundaries. Okay, so here what thenar space? So here is the thenar space. The thenar space, the medial boundary is formed by the intermediate palmar septum, right? Intermediate palmar septum. What about here? Here, this is the medial. Okay, so here the medial boundary is formed by the medial palmar septum. Here the lateral boundary, in the thenar space, the lateral boundary is formed by the lateral palmar septum. Here the lateral boundary is formed by the intermediate palmar septum. See, here the lateral boundary is formed by for the midpalmar space, it is formed by the intermediate palmar septum. Now, both the space communicates proximally with space of Porona, right? It is a forearm space, so it also communicates with the space of Porona. This too communicates with the space of Porona. So if it goes proximally, it communicates both the thenar as well as the hypothenar space. When it goes proximally, it communicates with the space of Porona. But if it go distally, okay, so if we go distally, this thenar space communicate with the first web space. Okay, first web space. But here it is with the second, third and the fourth web space. Okay, so these are the communication, these are the boundaries and the communications of the fascial spaces. Hence it is not over, and here we have the dorsal spaces. So here we have seen about the palmar spaces. If we speak about the dorsal spaces, it is the dorsal subcutaneous space, right? It is the dorsal subcutaneous space. And this one is dorsal aponeurotic space. Okay, so now this is about the dorsal spaces, and one more important space that we have to deal is the pulp space. Okay, that we will see subsequently now. Yes, now we'll go to the pulp space, right? So for drawing the pulp space, see, I'll draw. This is the middle phalanx and let it be the distal phalanx, right? So this is the skin. Okay, so this is the epiphysis and this is the diaphysis. This let it be the epiphysis and diaphysis of the distal phalanx, and this is the pulp space which is divided into so many compartments filled with the connective tissues. Okay, so this is the pulp space. Okay, so normally it is a space that is present between the skin. Okay, present between the skin and the periosteum of the distal phalanx. So the pulp space is nothing but it is the space that is present between the skin, okay, and the periosteum of the distal phalanx of the finger, and the space is divided into numerous loculi, numerous septas, okay, numerous septas that divide that space into several compartments. Okay, so it consists of the connective tissue inside. So any infection here will leads to the increase in the compartmental pressure that leads to the pain. Okay, throbbing pain, severe throbbing pain will be there if the compartmental pressure is increased due to the infection. So now what is that means? Normally the digital arteries which is supplying here will go and it supplies the epiphysis and it also supplies the diaphysis. Okay, so now the digital artery which is supplying the epiphysis is not included in the pulp space. The point to note, the epiphyseal artery, the digital artery which is supplying the epiphyseal part of the distal phalanx is not included in the pulp space. So any problem or any infection in the pulp space will not affect the blood supply of the epiphysis. Okay, so any infection will not affect the epiphysis, since the artery, the branch of the digital arteries branch supplying the epiphysis is not included in the pulp space. Okay, now we will move on to the applied aspects. So we know that there is the Midpalmar space, Thenar space, pulp space, and the dorsal subcutaneous space and the dorsal aponeurotic space. So many spaces are there, and we will see if the space is infected, how we have to put the incisions and we have to remove the pus. So for that, let me draw a simple picture. Okay, let it be. So this is the so here inner hollow, here will be the what space? Here will be the hypothenar space, Midpalmar space, and here will be the thenar space, right? Here will be the thenar space and here will be the Midpalmar space, right? So now any infection here will be drained by putting incision. Okay, so here will be the first web space is for the draining of the thenar. So this will be the thenar space, right? So the first web space, the incision is for the thenar space, and third and the fourth. Okay, third and the fourth, this will be, so the hypothenar space will be draining into the third and the fourth web space. So this is the first web space, and here this is the third web space, and this is the fourth web space. So if we put, so this space, we already thought, no, this will be communicating with this space. So hypothenar space will be communicating, that is the hypothenar is not the hypothenar, it is the Midpalmar space, sorry. So okay, so this is the Midpalmar space that will be communicating with the third and the fourth web space, and the thenar space that will be communicating with the first web space. Okay, so now if any infection in the palm, that the incision should be put longitudinally. Okay, the incision should not be involving the tip because it will affect the tactile sensation. So it always at the side of the proximal phalanx, so that it opens all the compartments, so that pus from all the compartments will be relieved. So this is the incision. If you want to drain the Thenar space, you have to put the incision in the first web space. If you want to drain the pus in the Midpalmar space, in either third or the fourth. If you want to drain the pus in the Pulp space, then it is you have to put incision, longitudinal incision on the either side of the phalanx, not on the tip. Okay, so now any infection in the Pulp space is called as Whitlow. Okay, it is called, any infection in the Pulp space is called as Whitlow or Phelan. Okay, so what happened, it will any infection we already Phelan. So any infection, it will compress the artery, so that it will leads to the, any infection here leads to the pus accumulation that will compress the artery, that leads to the avascular necrosis. So any infection leads to the avascular necrosis of the distal phalanx, distal diaphysis, avascular necrosis of diaphysis of distal phalanx, but not the epiphysis. We know the reasons already, because the artery supplying, the branch supplying the epiphysis is not entering into the Pulp space. So any infection, any Whitlow or Phelan will leads to the avascular necrosis of the diaphysis, but not the epiphysis. Thus we come to the end of the fascial spaces of hand.